Good afternoon and welcome to today's webinar, Driving Safety Among Older Adults, a Medical Perspective. My name is Juliana Valencia and I am a Social Services Specialist with the Area Agency on Aging. You should have received an email this morning with the slides, so you'll have them for future reference. You will also get an updated version of today's presentation at the end of today's presentation. Now, our presentation is being recorded and our recording is going to be sent to all registrants by early next week. Also, there will be a brief survey as you signed out. Please help us by giving us your feedback. We really value your opinion. I also want to mention that we will have a few minutes for questions and answers at the end of the presentation. So please use the question box on your panel to submit any questions or concerns that you might have during today's presentation. Now, it is my pleasure to introduce today's speaker, Dr. Sangeeta Shanbala, who is a geriatric physician on the Geriatric Consult Service at Inova Fairfax Hospital. She is a fellowship-trained geriatric physician and is board certified in geriatric medicine, hospice, and palliative medicine, and internal medicine. She has several years of experience in managing complex medical problems and geriatric syndromes in older adult patients. Her special interest is to be a physician champion to support an interdisciplinary approach to promoting driving safety among older adults. Dr. Shambhala is going to share her knowledge with us today. Thank you, Dr. Shambhala, and welcome. So I'm going to send you the request so you can share your screen with us.
Yes, thank you for that lovely introduction, Juliana. I'm very happy to be here to be talking about addressing driving safety among older adults. Addressing driving safety among older adults is essential, but it can also be very challenging. Let's start by looking at a case scenario that puts things in perspective in real life. Mr. A is brought by his son to his appointment with his primary care physician. He has been with his physician for the last 2 years, and he's 82 years old, independent in all his activities of daily living and instrumental activities of daily living. When we say activities of daily living, these are basic activities that is essential to maintain one's life in a healthy way. For example, be able to go to the bathroom, provide toileting for themselves, grooming, bathing, dressing, eating or feeding, and walking. And instrumental activities of daily living are higher activities that are required to support the patient to live a healthy life, like preparing meal, shopping, managing their own finances, managing their own medications, cleaning, housekeeping, and be able to telephone, and also driving or manage their transportation. So thus, Mr. A has started using a walker after his recent fall, and that resulted in a left hip fracture. And he was hospitalized for this and had a hip replacement. He is now returned to his own apartment after rehabilitation. He also wears glasses and hearing aids. He manages his diabetes by checking his blood sugar and giving himself insulin injection. And lately, he's noticed to miss few doses and meals. The patient also had recent minor car accident. According to him, it was not his fault. He was making a left turn at a stop sign and he hit a car that was coming too fast. The police gave him a ticket anyway. The son wants his father to stop driving, and the patient, or our older adult senior, says that it wasn't his fault and he should continue driving. So we see the son's perspective, and this is what most adults feel. On a more serious note, let's look at why we should address driving safety in our older drivers. We get data from various agencies, and one of the agencies that I like to go to is American Geriatric Society. So American Geriatric Society provided data that more than 6,000 people over the age of 65 in year 2017 were killed in traffic-related accidents or crashes. In 2017, around 289,000 older adults were injured in motor vehicle accidents. Unintentional injuries are seventh leading causes of death among older adults. Of this, motor vehicle accidents are second most common cause of unintentional injuries after falls. Beginning at age 75, older adults have higher fatality or deaths rate per mile driven by any other age group. As per CDC report, which is Central for Disease Control report, that's another agency that I get information or data regarding this issue, shows that the fatal crashes per mile traveled is increased for individuals ages 70 to 74. A number of fatal crashes per miles traveled is highest among the drivers. The multi-vehicle crashes accounted for 40% of fatal accidents in ages 80 and above, as compared to 20% of drivers among the ages 16 to 59. So there's definitely a disproportionately high rate of poor outcomes in older adult drivers. There are more chest and head injuries, and we'll see why this is happening in terms of physiological changes that are associated with normal aging process and diseases that are commonly affect the elderly and may compromise their ability to drive safely. Older adults face unique challenges because driving is a complex task that requires a variety of skills, including physical, cognitive, behavioral, and sensory perceptual abilities. As we grow older, our vision declines, our hearing declines, our ability to react or our reaction time increases, our flexibility, which affects our joints and affects our ability to maneuver the steering wheel and also to clear the blind spot by looking over our shoulders. There is also risk of illnesses that commonly affect the elderly. For example, the cardiovascular disease or the diseases that affect the heart puts the patient at risk for heart attacks and chest pains that can happen while that person is driving. Diabetes puts the patient at risk for sudden low blood sugar or hypoglycemic episodes. This itself can affect their vision, or one of the complications of diabetes is diabetic retinopathy that affect people's vision. Neurological disorder like dementia, Parkinson's disease, stroke can affect cognitive and cause cognitive dysfunction. Arthritis, as I mentioned before, affect their flexibility and dexterity. Drugs and alcohol always have effect on driving, and this will have an exaggerated effect on the elderly. Frailty is very common. There is a progressive functional decline that affects the person's ability to walk, balance, taking care of themselves, etc. Osteoporosis is seen in elderly patients above 65 and 75 ages, and it increases the risk of fracture. Atherosclerosis or plaque formation in blood vessels. And if it's formed in aorta, the major blood vessel in the human body, it can also predispose the patient to have an aortic rupture when there is a chest trauma in a motor vehicle accident. So when should we address the driving safety or have a driving ability assessed? There is no particular age limit, but we'll give you some information that helps you decide when you should address it. When the older adults noticing or family members noticing that they're forgetting to buckle up, or they have difficulty in operating pedals, have difficulty in merging with freeway, on the freeway, on a busy street, have trouble seeing other vehicles, cyclist or pedestrian, especially at night. This may be because of vision loss, or it could be because they are not able to clear their steering wheel. As we grow older, because of physiological changes, we do lose height. We are more hunched, so you would have difficulties in doing these things. Because of cognitive impairment or memory losses, we may be missing stop signs and other traffic signals. Hearing loss can make us react slowly to sirens, flashing lights of emergency vehicles. If you notice that one is weaving or drifting into other lanes without signaling, or getting lost or disoriented easily even in familiar places. This is commonly seen in individuals with dementia. Once again, unable to hear sirens and horns and even our own turn signals when we turn it on in our car, which makes a ticking noise, if you have noticed before and you're not noticing any longer. Receiving more traffic tickets, warnings, having near misses in the past 2 years, received traffic violation, unable to adjust to the glare of headlights and sunlight. This is very important. If you had a serious illness and you were hospitalized and had falls or had major illnesses like a heart attack or a stroke or being diagnosed with dementia, it's very important you have your driving addressed. So these are some of the things that I discussed in the previous slides, but to reiterate the importance of if you notice these things, I'll just go over these things once again. If you're unable to clearly see over the steering wheel, if you're not able to turn your head an equal distance from one side to the other, unable to turn head and neck far enough to see over the shoulder, unable to lift your arm to adjust the rear view mirror, unable to keep a firm control grip on the steering wheel with both hands while keeping your elbows bent and relaxed. So when you see your doctor and the doctor is asking these screening questions, are you driving? And if it is an yes, if you're having any accidents, near misses, or problems with getting lost in the last 12 months, yeah, and if the answer is yes to this question, then you should have your driving evaluated. So who is going to help you addressing driving safety or driving reevaluation or evaluation as we age is your physician. Before we talk about being reported as an impaired driver, let's just look at who can help you with this. The physician that you see can help you, nurse practitioners can help you, physician assistants can help you. I would come back to this slide about reporting an impaired driver in a little bit. So how are we going to have this addressed? Where can we get help? Remember, you're never too old to drive. It's not the goal to have all seniors stop driving. But we should have a patient-centered approach, recognizing the signs and understanding the importance of mature driver safety. It has to be a combined decision making with the senior, family, and the physician. And whatever decision is being made regarding driving, whether you're going to reduce the driving or drive with limitations, or retire driving or stop driving, it's likely will go well if it is voluntary, if the decision is made by the senior, rather than involuntary, where he is told to do so. Before we make decisions regarding the driving, it's important to address the barriers for the seniors if he is not going to be compliant with the recommendations. How is he going to find transportation? How is he going to drive to his doctor, to his social activities, have access to food? How is he going to shop? There is definitely adverse health outcomes with driving. If they're not going to have access to health, to their doctors, to food, and their medications, it's going to have a severe impact on their health. And if they're not able to continue their social activities, that's going to have a negative impact on their mental health. So if you go to a doctor for having a driving assessment, or a clinician, a nurse practitioner, or a physician assistant, it is recommended they use a clinician's guide to assessing and counseling older drivers. This is provided by American Geriatric Society. So what do you expect when you go for such an assessment? They will be assessing your physical capabilities, asking questions about falls, impaired ambulation, vision and hearing impairment, functional impairment with regarding to use of gas or brake pedals, decreased ability to turn the head to fully visualize an area. Cognitive capabilities will also be addressed. You'll be asked question about short-term memory loss, long-term memory loss, decreased or impaired wayfinding. Attention is very important. If you're easily distracted, inability to learn new information quickly can happen as a normal process of aging, but also common in dementia. Inability to recognize unsafe situation as insight declines. This is also commonly seen in individuals with dementia. The goal of the clinical evaluation is to identify, correct, or stabilize any functional deficit that may impair an older driver or driving performance, and to consider a referral to a driver rehabilitation specialist. These specialists are usually occupational therapists, and I'll be giving a little bit more information about that in the later slides. So screening of visual field will be done. Most of the adults with visual field loss are unaware of the deficits until it becomes quite significant. Failure to pass any of the measures of cognition, vision, and functional status in the clinical assessment of a driver-related skills. This is a tool that a physician would use, would elicit a referral, or will indicate to the clinician to refer the patient for further evaluation. As I mentioned before, occupational therapists do driving evaluation. Speech and language pathologists help with cognition, cognitive evaluation, and therapy. Neuropsychologists also do cognitive evaluation. Driving rehabilitation specialists are particularly specialized in addressing driving problems and help therapies to improve those driving problems. Other medical specialists who one can be referred will be could be neurologist. The driving ability should be checked periodically whenever the family members or the senior himself is noticing a problem or an issue. According to the Department of Driving, the driver's ages of 75 and older should appear in person to renew their driver's license. This gives an opportunity to have your vision tested and, if needed, your driving tested in terms of a written test and even a road test. There is a mature operator safety course that can be recommended by your local DMV, Department of Motor Vehicles. Other resources that you can find where you'll get information about assessing your driving ability and information of driving safety are Alzheimer's Association. That's a great website that will provide a lot of information about this issue. AAA, ARP, American Safety Council. There are also traffic schools online. Virginia Grand Driver is a program that's also available online. There are a lot of virtual older driver assessment that helps one to take and self-assess their driving abilities. Innova Mount Vernon Hospital has an outpatient occupational therapist providing a driving assessment. There are several rehabilitation programs for mature drivers that Virginia DMV can provide you with that information. And I found locally there are some occupational therapists that provide driver rehabilitation, like MedStar National Rehabilitation Network. Centara healthcare system also provides such service. Maryland area driver. So I put these information here so that it's useful for not only for Northern Virginia residents, but also our neighbors. National Highway Traffic Safety Administration is a great website to look into some of the resources. So how can we be safe drivers? Check your vision regularly. Wear your glasses. Take a driving refresher course for senior drivers. Attend CarFit. It's not only important for us to be driving fit, but car should also be checked. Avoid driving in poor weather when visibility is limited. Plan your route ahead of time. Limit left turns. Explore alternatives to driving before the need arises. That's the key, to be proactive, then reactive. Avoid busy highways. It's important to assess and prevent the loss of driving ability. So checking vision, checking balance, checking your ability to maneuver the steering wheel, the pedals is important so that you are proactive rather than reactive. Restore the lost driving skills through treatment and rehabilitation. It can be done. Then recommending alternatives to avoid harm to older adults, to themselves, to oneself, and others who are on the road when driving is no longer an option. And so instead of calling it driving cessation, I would call it driving retirement. We retire from our jobs, so we should be able to retire from our driving as well. So how can we transition? Transition the driving responsibility to others. Arrange for family members and friends to provide transportation. A great way of doing this is by donating your car to a family member. A grandchild would be a great idea. It gives a great opportunity to spend time, quality time with each other. And also, in a way, you're helping each other out. You can arrange for taxi service. Alzheimer's Association is a great resource to go in to their website because they provide information for special transportation services for older adults. You can access local resources using free community resource finder and also an elder care locator to help with transportation services. Reduce the need for driving by having prescription medications, groceries, or meals to be delivered to your home. The National Transportation website also has great resources for alternative transportation services. So, what if the senior refuses to stop driving? Or is not able to see the need to stop driving? Then what can we do? There are some things that we can do. It helps to plan early and put the onus on the senior. So it's rather than his decision. So he's making it on by his own volition rather than being told to do so. So if you plan ahead, we all should plan ahead for our retirement financially. So similarly, we should plan ahead for driving retirement. So Alzheimer's Association also gives you a great resource and information about some of these tips that you can do. So plan early and discuss periodically with the senior. Be very sympathetic when you address retiring from driving, because this is perceived as loss of independence, and it is very difficult for many. Keep a written record about your observation, and as a family member, help the senior to address this with their healthcare professional. So it appears, or it is, that you are addressing this problem with them and you're working with them, and it doesn't appear that you're working against them. Some of the tips to help the person living with dementia to retire from driving are transition, as I mentioned, transition the driving responsibility to others, and solicit support from others. Ask your physician to advise the person not to drive. Involving your physician in a family conference on driving may be more effective than trying to persuade the person not to drive by yourself as a family member. So what if the senior is reluctant to stop driving? Who can report an impaired driver? This probably should be the last resort, but it's very important. In the state of Virginia, however, we are not obligated to report or by law report an impaired driver, but it is important to keep the senior safe and others safe. So a physician, a nurse practitioner, a physician assistant, or even a pharmacist can report impaired driver to the Department of Motor Vehicle. Of course, law enforcement, judges, social worker, nurse, or even a family member can do the same. So usually such information is kept private, so it can be done with with anonymity. So reports can be submitted. A medical review is requested to the doctor, and these reports can be submitted on the Department of Medical Vehicle website, or can be faxed or mailed to their address. The address is on the slide. But we can also form a driving contract, put limitations to if it is appropriate to the drivers. Like, don't drive during rush hours. So drive during non-rush hours, limit your driving distance to 3 to 5 miles. So you still have the ability to go drive to your bank, your place of worship, grocery store, and avoid driving at night and bad weather. And once it's not advisable to continue driving, even with these limitations, then transition to driving retirement or driving cessation. With this, I'm open to take questions. And thank you for allowing me to talk about this very important problem or issue.
Thank you, Dr. Shambhala. Yes, we want to invite everyone in our audience to submit your questions. And while you do that, let's start with our first question. Dr. Shambhala, you briefly mentioned about the effects of medication in driving. Could you expand a little bit more and talk about how medication affects a person's driving ability to drive?
Thank you. That's a great question. So each medication have their own side effects, and when you are with your physician, please talk to your doctors about the side effects of whatever medications you are on and what kind of recommendations are there in terms of driving. For example, if you're taking a sleep medication that can affect your ability to stay awake, or even affect your cognitive ability that can affect driving. Blood pressure medications can also fluctuate blood pressure. If it drops the blood pressure lower, it can make a person to pass out or affect their driving ability in terms of their vision or even cognition. Same thing with diabetic medications. So I think I mentioned few right now, and as you see, different medications have different effect on our cognition, on our ability to stay awake and be cognizant to drive safely. So please have that discussion with your doctor.
Thank you. So we have a question from our audience. He says, 3 years ago, I took the AARP Senior Safe Driving course for my car insurance. In that class, they said that age was 80 or after to be required to renew your license in Virginia. I think your presentation said 75. Did that recently change?
That is a recommendation from the DMV. Check with your local DMV to confirm that.
Okay.
75 or 80.
Okay, thank you. Then someone else said, my father failed his eye test at DMV, but we got a note from his eye doctor and was able to renew his license. Does that work? Driving with him at night or in the rain is terrifying.
Yes, wearing corrective lenses, and if your ophthalmologist says it's safe for you to drive by wearing glasses, then it's okay to continue driving. And again, limiting driving during bad weather at night is recommended. If that's what your dad is experiencing, that is having issues seeing well due to glare of the headlights or in rain, then he should limit driving. But you can have more information from his own ophthalmologist, because ophthalmologists also provide their recommendations for DMV to maintain their license.
Okay. So one question that I have for you is, and you did touch on that a little bit, but if you could expand. So driving represents freedom and independence for a lot of people, for a lot of us. So as a family member, to step in, sometimes it's really difficult and sometimes can be very confrontational. So do you have any tips for family caregivers in addressing this conversation and what to look for?
I mean, it's very important to have the vision checked, the balance checked, And then if you're noticing issues like your loved one is getting lost while driving, or where while parking he's having difficulties, or he hit another car while parking, or pulling into the garage, he's made some dent. If you have any concerns, I would bring it up with your loved one. Dad, I'm noticing, or Mom, I'm noticing this. What do you think about it? What is their perspective? And that way you are giving them the independence to address that issue too. So while we have our blood pressure checked, right, when we go to the doctor's office, I think we should have our driving addressed. Same way our memory is checked or cognition checked. So this is very important. So you bring it up by asking the loved one what he thinks about it, and whatever he says, we approach it with some sympathy rather than taking in a paternalistic attitude, telling them what you noticed, rather I would have them express what they see. So in my experience as a physician, when I am addressing this, and I've done that a lot in the hospital and also in the outpatient setting in my office, I would bring this up and then ask them how they would feel about it. You're growing older, you're developing cataracts, or your vision is getting poor for whatever reason. Then I would ask them what is their understanding or their perspective about their driving. Then I would recommend them to have their driving checked. Whatever age, whether it's 75 or 80 or even 65, you can approach your DMV to give you a driving assessment, a written and a road test and a vision test. If they will be able to give you or information about driving schools and rehabilitation therapist. So you can do your own assessment, and that enables the older adult to make decisions. So and that way you're assisting them in making those decisions rather than telling them what to do. I hope this helped answer your question.
It does. Thank you. It was very complete. Someone just sent a comment. It says, just a comment. A person doesn't have to be an older adult or senior to have a heart attack while driving. It says, my 53-year-old, my 53-year-old nephew, a firefighter and EMT with no health problems, had a heart attack while driving his car, and it caused him to have an accident. So it's
correct. Anything can happen to anybody. Elderly are more prone to have such episodes because as you age, you not only decline physiologically, but it puts you at risk for these diseases more than young people. So if a 50-year-old can get a heart attack, the 74-year-old and 80-year-old are more at risk to get those. That's why it's important to address those issues. So if you have diabetes or risk of heart attacks, it's more so to keep that in mind. And there'll also be medications you'll be taking for those diseases that also puts you at risk. So these are in addition to the physiological changes that you're growing, as you grow old and developing adds to this risk, right? So the more you have more causes or more reasons to address driving safety as you grow older than when you're younger.
That makes sense. Quick question. I know that for family members, sometimes they do notice that there is a problem with their older adult loved one, but they are hesitant to take the keys away, or, I mean, they shouldn't without having those conversations, like you said, without addressing other factors. But sometimes when an older adult just came out of the hospital, they are thinking, I need to take those keys away because they are having memory impairments. But the older adult refuses to give their keys or to just stop driving. And so, but what I have seen is that the family caregiver cannot bring themselves to report or to confront or to have these conversations. I mean, I will say have the conversations because they feel confrontational. So what if they go to the doctor for help and the doctor says, no, I don't want to do that? Because I have had those cases. What does one do as a family member? What is another option?
The doctor has to address it. It's unfortunate if that, but the primary care physician is uncomfortable to address it, then ask him recommendation or referral to other physician, maybe a neurologist or a geriatric physician or occupational therapist, or some of the other specialists that I can think of that the doctor can refer. But I would prefer the primary care physician address it because they have the extended rapport that over a period of time, right? That is their advantage. But if the loved one, senior loved one is refusing to stop driving and is trying to drive and be an unsafe driver, that putting him at risk and also others on the road, as a last resort, you can take the keys away. Or you can work in a way that the car wouldn't start or cannot be operated. You can think about selling the car. If the person has a dementia, distraction is a great way, oh yeah, why don't I drive you? I want to spend time with you, and then so that that would be a better option than otherwise. You can actually report yourself to the Department of Motor Vehicle. And what will happen is when you send that report of an unsafe driver, the police actually would visit the senior and inform them that the driving license is suspended and that they're no longer allowed to drive. So that could be sometimes very terrifying for the senior, and it's usually not a very happy or a comfortable or a pleasant occasion to have police visit you. But those are the things that you can do as a last resort. Sometimes you have to. If dementia is an issue, and this could be lack of insight because of the dementia, and also could be a behavior problem when the senior is becoming very upset and aggressive, you might have to be referred to a neurologist who can help you with those behaviors, or a geriatric physician, or a neuropsychiatrist also.
Very well. So how can a person prolong driving as they get older?
Have your driving assessed. Keeping your vision, hearing addressed is very important. So you wear proper eyeglasses or lenses, wearing hearing aids, and keeping yourself physically fit is also important. Addressing your balance, exercising is important. And if you notice any of the deficits, like I mentioned before, have it addressed. And sometimes or most often, I think it's a great idea to ease or slowly stop driving rather than an abrupt cessation. Right now, I can't drive anymore, or have the inevitable happen. Some drastic event, you met with an accident, and then stop driving rather than doing that. So you do these changes to maintain your driving. If you start noticing it's difficult to drive, then you start driving with limitations, then it is inevitable in most cases that you will stop driving. It's not like we're going to drive until our end of life. Some of us might do it, but if it is not possible, I think it's okay not to drive. We retire from our jobs. We can also retire from driving and let somebody else do that for us. Rather than looking at as loss of independence, we are just making some lifestyle changes. And I think that's the key word, right? These days, make lifestyle changes. And one of the lifestyle changes you expect to make as you grow older is to stop driving or drive with limitations to begin with and then stop driving. In case things change, in case things change in terms of your strength and ability, then you can get driving rehabilitation. And then, so it's not a one-way street, you just stop driving. You can also have driving privileges reinstated if you can show that you improved your driving and you can be a safe driver.
Could you talk a little bit more about driving rehabilitation programs? I mean, do you have to be hospitalized and discharged to qualify for one of those, or can anyone who wants to improve their driving as they get older access those programs?
Yeah, most of these programs are private pay or out of pocket. Medicare or other insurance, to my knowledge, don't cover these charges. So there is no requirement that you have to be hospitalized. I would reach out to your local DMV because they'll give you information about driving schools, just like a teenager, right? Or even any young adult that's received a lot of driving citations, have their driving suspended, are asked to go to these driving schools and have their driving assessed and go through an education program and then having their driving license reinstated. It's not a question of having a driving license, correct? It's the question of being a safe driver. So the driving rehabilitation program, there are several. One is provided by Innova, Mount Vernon, occupational therapy, outpatient. You can reach out to them. There is information there in the website, in the Innova website, and all those ARP, the National Traffic National Highway and Traffic Services have information on their website. Alzheimer's Association have it on their website. The DMV will give you the information, so you can take these driving schools or rehabilitation specialist and have your driving assessed and trained. Sometimes you may not be able to correct your impairment. I think you should also have that in your back of your mind.
Well, thank you so much. This presentation has been very, very insightful. I just want to let our audience know that we will be emailing you the PowerPoints with all the information that Dr. Shambhala gave today. Also, we have one more question. It says, if a car made to be disabled so a senior can't drive, to be sure to tell neighbors and friends of the senior so they don't help fix the car. My neighbor's children disconnected the battery cable of their mother's because the person had dementia, so she couldn't drive. So when they were not with her, their mother would ask a neighbor to help start her car. That went several months and police contacts before everyone got the same information. I guess that's very important, maybe a point to be addressed when you are thinking in disconnecting your parents' vehicle or your loved one's vehicle. What do you think about that, doctor?
I think that's a great idea. Get everybody on the same page, because our loved ones, even my patients, they may not be they may be disabled in certain areas, but they're still very smart. They would know how to get help in terms of to do what they want, right? If they want to drive, they're smart enough to go and get help from anybody that they know. You're right. Get everybody on the same page, family, friends. These days you have WhatsApp groups, just that way you can also keep the senior safe, keep an eye out for them. The important thing is, if we are disabling their car so they cannot drive, I think it's important to check on them periodically and say, hey, do you want me to drive to the grocery store? Because senior is trying to go somewhere, right? So if they are trying to get somebody to fix their car, and if that individual knows it, maybe they can ask, do you need something? Can I pick up something for you? Or do you need to go somewhere? Can you help to, if they are not able to drive, or at least help them with transportation. I want to add one more information at this time. The Metro Access, right, also provides transportations for elderly who are not able to drive by themselves, but there are certain criteria. There are forms that need to be filled. You can approach your primary care physician as well to get that access. Metro Access provides transportation for elderly as well.
Thank you, doctor. And also I want to remind people, just feel free to call our intake line, our adult disability in caregiver resource line. We will be happy to provide information about transportation. So at this point, we are getting ready to end our webinar today. And as you signed out, there will be a brief survey. Please take a moment to answer those questions because it truly helps us provide topics that you are interested in. And we want to hear what you thought of today's presentation. I also want to invite you to our next caregiver webinar, which is on Wednesday, August 18th. Our topic will be on caregivers' grief, loss, and coping. Dr. Shambhala, the information you provided today was very insightful, very thoughtful and thorough, and really a good way to approach this complex subject. So we hope that you got valuable information today. Thank you, doctor, for giving us your time and your expertise. And to everyone in our audience, thank you so much for being here, for submitting your questions. And we really value your time, and we are glad that you decided to spend an hour of your day with us. So everyone, thank you and have a great afternoon.
Thank you. Thanks for having me. Bye.
Thank you. Bye.